Thank you all for coming tonight. My name is Jane Lonsdale. I am with KCEN TV. Now, we are grateful to be able to host this community discussion on medical facts about Ebola. We have already received many questions from members of the community that we are going to start with this evening. Now, we have note cards available for you to write down additional questions. You can pass those cards to the aisle, and staff members will collect them and bring them along to me. The panel members will answer as many of your questions as we can get to, and any additional questions that we do not have, they'll be posted on Baylor Scott White websites along with those answers. Now I want to thank Baylor Scott White doctors for being here with us this evening. Tonight they are Dr. John Boyd, the Chief Executive Officer and Chief Medical Officer at McLean Children's Hospital, Scott and White. Also Dr. Dominic Lucia, Director of Emergency Medicine at McLean Children's Hospital, Scott and White. We also have Dr. Karen Brost, Medical Director of Infection Control for Central Texas Division of Baylor Scott White Health, and Dr. Tiffany Berry, Chief Quality Officer for Central Texas Division of Baylor Scott White Health. Thank you so much for being here with us this evening. Now, first I want to start out with the first question. How is Ebola transmitted? Dr. Brost?
So Ebola is a virus that lives inside every single body fluid in an infected person. And so for another person to become infected from the original infected person, there has to be direct contact with those body fluids. And so what we have experienced in the West African setting is somebody taking care of a family member that perhaps was vomiting, and they were cleaning up the linens off of the bed. It's a little bit different here, obviously, in Dallas with the healthcare setting. That was really kind of, there's talk about breaches in protocol, but I think a lot of us are concerned with direct connection with body fluids in terms of blood, viremic blood, which means that the Ebola virus would be in high numbers in somebody's infected body.
Okay, now I think people are wondering this question: when is Ebola especially contagious?
Ebola, we've heard this answer, and it is the true answer. Ebola is contagious when you begin having symptoms. Up until that point, the virus level in your body is not such that you are contagious. You have to have a certain level of those virus particles in your body before you can spread it. And at that point, you actually begin developing symptoms of the disease.
I think a lot of people have been wondering whether Ebola is airborne or not. So we'll go to that question, and along with that, how do we know when it isn't airborne or that it will not become airborne?
Absolutely not. It is not an airborne transmitted disease. If it were airborne, I kind of ask everybody to reflect on the population of Africa. Africa would be decimated with 10 months of Ebola outbreak going on if this was an airborne disease. It is not an airborne disease. However, here in the U.S., our healthcare infrastructure is so different than West Africa that we do things a little bit differently. We really strive to protect our healthcare workers. And because we do things here such as intubating patients, so putting them on full life support, and doing procedures of the lungs that might aerosolize some viral particles, then we've asked our people to protect themselves a bit more, but it is absolutely not transmitted via the air.
So you will see us take airborne precautions, is what it's called, but it's not because the virus itself is airborne, it's because we aerosolize the fluids of the body during some of the treatments that we perform. I hope that makes sense.
Like coughing, sneezing, those things aerosolize viruses, very simply.
Let's talk a little bit about the signs and symptoms that you should look out for with Ebola.
Well, Ebola, generally speaking, fever, headache, vomiting, diarrhea, muscle aches, very similar to what you would find with the flu-like illness. So they're very, very similar. Most folks start with abdominal pain, fever, and some GI discomfort is usually what we start out with.
Okay, thank you. Now, is there any way for Ebola to be transmitted without direct contact with an infected person?
No. No.
Okay, and how can we best avoid putting ourselves at risk?
Don't go near an Ebola patient. Would be my answer to that.
Yeah.
Quite frankly, I think that obviously we're a very different community, the medical community. My job, should an Ebola patient come into this hospital, is to take care of that patient. I will be in direct contact with that patient. You do not have to be in direct contact with that patient. I will have to go through the method to best protect myself from getting infected.
Now, why is there such a high fatality rate with the Ebola disease?
Yeah, it's a bad disease. Go ahead.
It's a very high stakes germ is kind of what we're saying. It belongs to a family of viruses that all have very high mortalities associated with it. And this particular virus is not very good, actually. It is not what we would call an efficient virus. It gets in a human being and it kills that human being before it's able to propagate through the community. I think I'm getting too technical.
Probably a little bit.
That's the truth. I mean, I guess there's a
It
lot of
replicates
mortality.
very quickly. It gets you highly infected
Right.
very quickly before we have a chance to really support you through the illness, or your body has a chance to catch up and produce its own immunity. And what Dr. Brust is saying is, if you're a virus, that's not necessarily a good thing. You
Right.
want to be indolent. You want to have a slow infection so that it spreads additionally. But Ebola gets you sick very quickly, and your body just doesn't have a chance to catch up.
And it's really a massive dehydration. So,
There aren't any antiviral agents that are known to be real effective as well, as I understand, Dr. Russ.
yeah, there's no treatment available for it. It's purely supportive, so what we would call just trying to keep up with someone's fluid loss.
There are the experimental treatments, but again, those have no significant clinical evidence behind them at this point.
Yeah, Dr. Brust and Dr. Berry, that was going to be my next question. What is kind of the current treatment plan when someone is diagnosed with Ebola, and are there certain medications available?
Dr. Lucia?
Yeah, the only treatment at this point is supportive care, as we've discussed already. There's other experimental drugs. I believe some of you have heard of the ZMapp drug. I believe that stocks are out on that right now. They've done some blood transfusions from compatible donors. I know Dr. Kemp Brantley donated to at least one of the nurses from Dallas, but this is all experimental. I believe the FDA has lifted a lot of the restrictions that they put in the long process that it takes to vet a drug or treatment into that population just because of the urgency of the disease.
Do we have any information on, a possible vaccine or future medications, anything like that?
We are very far away from any effective vaccine.
Okay, thank you. Now, how is Baylor Scott White Hospital specifically preparing for possible Ebola cases?
We are constantly evaluating, what does the NIH say, what does the World Health Organization say, what's the latest and greatest thing that people are doing to contain this, treat this, keep our employees, keep our community, and our patients, of course, safe. We really are going, in many cases, even above and beyond what the current recommendations are, like I stated earlier. We're doing drills routinely. We're training, significant training that we've done. Protocols. These things are all about protocols and having standards that you do.
Okay, doctors, at this point, we're going to open it up to our town hall members today. The first question today is, what are some of the most common misconceptions you've heard about Ebola that you would like to correct?
Why don't we kind of just go down the line?
Yeah.
We'll start with Dominic.
So I suppose the one I dealt with the most today was the fact that if your child was in school with one of the children that they came back, that constituted an exposure. And it does not constitute an exposure. These patients are asymptomatic. They're being kept out of school in an abundance of caution, quite frankly, at this point. But that does not constitute an exposure. That does not mean the child needs to be screened or tested for Ebola. You go about your everyday life. We're entering viral season as it stands, flu season, that sort of thing. So there's going to be these very similar symptoms out there. Obviously, as you would seek health care in any other situation, I'd continue to do that. But otherwise, being at those schools does not constitute an exposure. That's the biggest misconception I heard today.
I think we actually already addressed it, that it's airborne, that you can get it by being in the same room or something of that nature. That's a misconception that many, many people have. And as Dr. Brush pointed out, you have to really be in very close contact with body fluids to contact the disease. And these folks that contact the disease are people that take care of patients with the disease itself, not being in the same building that they're in.
I will say, though, that one that makes me a little sad, and maybe it's because I use Facebook too much, but there's an innate distrust of the medical community that I feel, and I think a lot of that is because the information does change, and so you hear one thing one day, and then the next day something else comes out, and the next day something else comes out, and that's hard. That's hard for me to read. I mean, when I read these things, I'm frustrated too. I can't imagine how it feels to not even necessarily be as ingrained in all of it, like we are. There seems to be a distrust, though, of medicine in general and saying, you're just not telling us. You know things, you're just not telling us. Our job, and again, I'll get teary again. It's been a long week. Our job, and we take this very seriously, is to protect you, first and foremost. We protect our patients and our communities, and we do stay up to date on the latest medical literature. I can tell you we're scouring things regularly, and we would not keep that secret. The World Health Organization would not keep that secret. The National Institutes of Health would not keep that a secret. So I understand why there's confusion and dissension in the ranks of America. But I hope that you can kind of stick with us through this, and we can trust each other to be honest and to take care of each other.
Yeah, I would echo that. We all live here. We're ingrained in the community. I have 4 kids myself, and I'm not doing anything different with my kids than I'm talking to my patients and their kids about doing.
That's right.
There's no secrets here. We're trying to get through this together. As I said, we're learning as we go along. But this is something that I think that Tiffany said basically earlier. That's why we're coming to you as members of your community to help you through this.
Okay, thank you, doctors.
Thank you all.